Liver is an important organ in human body. It plays central role in the metabolism of human body. It performs various important functions like producing enzymes for digestion of food, producing clotting factors which help in stoppage of bleeding, detoxification and so on. That's why liver plays a central role in the metabolism of your body. Liver function tests include various tests for serum bilirubin, different enzymes like SGPT, SGOT, alkaline phosphatase, and tests for serum proteins and albumin. Some other liver function tests are prothrombin time and activated partial thromboplastin time. All these tests help in early detection of liver diseases. If you detect liver diseases early, it helps in preventing their progression. Also, an important fact about liver is that if you detect the liver diseases early, there is a good chance that you will be able to reverse the damage that has been already done. If at all the liver diseases have already happened, as are seen because of deranged liver function tests, then you can prevent their progression and also the certain complications like occurrence of liver cirrhosis or liver cancer. Let's see what is the interpretation of routinely done liver function test. Serum bilirubin is a test which detects increase in the amount of bilirubin. Now you will be wondering, what is bilirubin? Bilirubin is what a common man knows as pitta. So bilirubin increases in various types of hepatitis. In cases of viral hepatitis, mainly the bilirubin levels are very high. In case of children also, that is the neonates, bilirubin levels are high, but they are called as physiological jaundice. Now there are certain liver enzymes like SGPT and SGOT which are also increased in cases of viral hepatitis. There are few other reasons in cases where isolated these liver enzymes are increased. For example, if there is a toxic injury to liver because of various industrial toxins, or in some certain cases because of drugs, then there is increase in the liver of liver enzymes like SGPT and SGOT. There is an enzyme known as alkaline phosphatase which is peculiarly increased in diseases where there is obstruction in the flow of bile. Bile is something which contains the bilirubin or other enzymes. So if there is obstruction to this bile, then the enzyme known as alkaline phosphatase increases. There are certain common conditions where you find increasing alkaline phosphatase, like in cases of gallstones or the stones which are found in your gallbladder. Then coming to the proteins, albumin is an important protein which is produced in the liver, and albumin levels are seen falling in cases of advanced liver diseases. Then there are certain clotting factors, as I mentioned earlier, like prothrombin time. So prothrombin is a clotting factor which is also produced in the liver, and in cases of bleeding disorders, the levels are seen to be decreasing, and consequently the prothrombin time, which is a lab test, the levels are seen to be increasing. So this is in very simplistic way the explanation about the liver function test which we commonly do. But at the same time, several advances are occurring now which can help you detect the liver diseases at much earlier stage. In cases of advanced liver disease, you know, the important thing that happens in liver is the fibrosis, that is increase in the number of fibrotic tissue within the liver parenchyma. To detect that will help you greatly in assessing the liver disorders at an early stage. For that, radiology has come to a great help. Ultrasound or sonography, as you commonly know, is used for detection of this fibrosis. But routine sonography detects fibrosis or liver cirrhosis at much later stage. So there is something which is known as fibroscan that has been increasingly used, which can pick up the fibrosis in the liver at much earlier stage. Nowadays, help of MRI or magnetic resonance imaging technology is also taken to assess the amount of fibrosis in liver, which is this particular test is known as MRI elastography. Then there are certain other tests like PCR or polymerase chain reaction, which are used to assess the quantity of virus that is present in your blood in cases of viral hepatitis. So PCR, majority of people know now because of COVID. The same technology is used here for assessing the quantity of hepatitis B virus or hepatitis C virus in your blood. And if your viral counts are very high, there are certain drugs which are available that will reduce it and thereby prevent the subsequent damage that is going to occur to your liver. Various signs and symptoms of liver disorder include feeling of lethargy or weakness, and in case of advanced liver disease, a symptom known as jaundice is often seen. What do you mean by jaundice? Jaundice means yellowish discoloration of your body parts, mainly the sclera and also the skin. Often the person is seen to be passing high colored urine. In certain cases there is weight loss also. If there is an advanced liver disease which a patient is harboring, then he may present to a doctor with certain symptoms like bleeding through anus, or sometimes vomiting of blood. That is something which will indicate a severe liver disorder. Various risk factors for the development of liver disorders are as under. The most important factor is the consumption of alcohol or alcoholism. If you consume alcohol daily or very frequently, alcohol acts as a toxin and damages your liver to a great extent. Other risk factor in today's world is the diabetes mellitus. As you know, India is becoming the capital of diabetes. Deranged blood sugar levels cause a process what is known as gluconeogenesis that leads to accumulation of fat and fatty substances in liver, thereby damaging it. Third important factor is consumption of unhygienic food. There is transmission of various bacteria and some viruses like hepatitis A, hepatitis E, which are transmitted through your contaminated food, and that lead to what is known as hepatitis. Other important viruses which cause the liver disorders are hepatitis C and hepatitis B. They are transmitted through blood or blood products and also through sexual contact. So these viruses cause chronic damage to the liver and lead to certain complications like liver cirrhosis or liver cancer over a long period of time. Nowadays, awareness about different diseases of liver has progressively increased, mainly due to different campaigns in the media. The single most important factor, as I mentioned earlier, in causation of liver disorders is alcoholism. Therefore, to prevent alcoholism, various campaigns are taken by government also. There are social organizations like Alcoholics Anonymous who are doing a great noble work by making people leave alcohol. Then there are psychiatrists and psychologists who also help in counseling and thereby reducing the stress of the patient, thereby leading to decreased alcohol intake and prevention of liver disorders. Another important factor which has emerged in the recent years is the diabetes. As you know, India is going to be the capital of diabetes mellitus soon. The strict blood sugar controls are very important in prevention of liver disorders, because any excess sugar in your blood is going to accumulate in your liver in the form of fat, and that's going to lead to what is known as non-alcoholic steatohepatitis or NASH. So strict control of blood sugar levels are helping in preventing liver disorders. Then there are certain chronic liver disorders which are caused due to viruses like hepatitis B and hepatitis C. They lead to what is known as chronic liver disease. government is running a campaign by immunization program for hepatitis B, and hepatitis B vaccine is now part of national immunization program. This is extremely important, especially for healthcare workers who are constantly exposed to blood and blood products. All such health workers need to get themselves vaccinated for hepatitis B so that the infection is prevented. Last but not the least, regular health checkups form the cornerstone of early detection of liver disorders, and as the awareness about regular health checkups is increasing, there is increasing number of patients who are picked up at early stage, and thereby progression of the liver disease is prevented. The most important factor for preventing the liver disorders is stoppage of consumption of alcohol. If you stop consuming alcohol, which is considered as the single most important hepatotoxic substance, whatever the damage that has occurred to your liver can be reversible. Therefore, prevention of alcoholism or stoppage of alcohol consumption will be the first strategy in prevention of liver disorders. Second important thing in preventing liver disorders is consuming right kind of food. Remember the tagline, food is medicine. Why food is medicine? Because if you consume food that is rich in carbohydrates and fats, the same high amounts of fats and carbohydrates are going to accumulate in your liver in the form of fat, and it will give rise to a cascade of reactions that will lead to chronic liver disorders. How? Once you have increased amount of fat in your liver, it leads to a condition known as fatty liver. The fatty liver, if it persists for a long time, then it give rise to inflammation in your liver, which is known as non-alcoholic steatohepatitis. And non-alcoholic steatohepatitis, if it persists for a longer time, leads to starting of fibrosis in your liver, and once the fibrosis starts, it is more or less a irreversible process. So if you consume right kind of food, that is the food which are less in carbohydrates and fats but rich in proteins, you will prevent accumulation of fat in your liver and thereby help in prevention of liver disorders. Now you will be wondering, what are such foods? Such foods are green leafy vegetables, fresh fruits, dry fruits, and the different proteins or the foods which are rich in proteins. So try to limit consumption of your mithais, ice creams, ghees and all, and thereby help in preventing the liver disorder. Third strategy which is necessary for prevention of liver disorders, particularly chronic liver disorder, is the vaccination. As I have previously also said, that hepatitis B and hepatitis C are the viruses which are going to cause chronic liver damage and going to lead to different complications. So hepatitis B vaccination is very important, especially for healthcare workers and even to general population, because hepatitis B virus gets transmitted to blood and blood products and also through sexual contact or the sexual intercourse. Therefore, complete vaccination of general population is necessary. Government has included it into national immunization program. So hepatitis B vaccination is very important. And remember the different complications of liver disease, that is liver cirrhosis, which is irreversible, and sometimes that can lead to hepatocellular cancer. That will put a great burden on your health. It will cause debility, loss of your healthy years, and even loss of life in certain cases. Therefore, prevention of liver disorders is very important. The regular health checkups will go a great way in detecting them early, preventing their progression, and stopping the complications like liver cirrhosis and liver cancer. So this Liver Day on 19th April, make a pledge to get yourself tested for liver disorders by doing liver function tests. Thank you.